Okay, this video is about what's called corrective stretching. So corrective stretching is a routine where you stretch and strengthen together. So it's kind of a pair of two, a stretch and an activation or exercise together, which help to fix a dysfunction in a lot of joint problems. So this first one here is for the lower body. So if you're having low back issues, hip issues, things like that, this one's kind of geared towards that. Very simple. Something you can do a couple times a week to complement what you're doing with your exercise and activity program. But the main thing with this one, I'm going to zoom in as we go along, is that there's 6 movements. So the first column, or the left side column, is going to be stretches, and the right side column are all activations or exercises. Now these don't require any equipment at all, limited space, just some floor space, but you don't need any equipment at all with these. You might want a mat when you're on the floor if you have a hard surface, but pretty much very simple things but very effective. Now this is for the lower body, so again in V4 if you have a weak back or chronic back pain or hip pain or things like that, typically this is going to be things that would help you with that. Okay, so it's kind of a version of core training, but it's more the lower end of the core. The other program is going to be the upper body for neck, back, and shoulders. It's going to be the upper back. This is primarily low back, hips, hip flexors, all that good stuff. I'm going to show you how it actually works to correct this. Now our muscles are kind of like rubber bands. So rubber bands basically pull, right? So they pull in. We have opposite muscles. Typically one muscle is going to pull, the other is going to stretch. So they kind of counteract each other. So if I had this rubber band here, and I'm looking at it this way, so if this front side here was your hip flexors in front, and the back side is your hamstrings, when they're at normal length, they're going to have tension on them. Okay, so those have a bit of tension or tone. That's also referred to as tone. So when you curl your hamstring, the back side of this rubber band would pull up, and the front side would relax. When you actually do a hip or a flexion or anything like that with the front, so you bring your leg up, you're shortening the top, and then the hamstring actually relaxes a bit. So they kind of offset each other. So what these are they're basically movements where you're stretching one muscle before you work a weak muscle. So you stretch the short muscles, you work the weak muscles. Stretch the short, work the weak. Now they're paired up. So this program, you always have to go in pairs. You can go from the bottom up or top down, doesn't matter, but they always have to be done in pairs in this sequence. So very simple and direct. I'm just going to zoom in here a bit so we can see these better. Okay. Very large now, hopefully you can see it a bit better. Again, there's PDFs for these with this program, so you shouldn't have any issue seeing them on a smaller scale. I just want to zoom them in so you can see them nice and clear. So the first one here is called a hip oblique stretch. So what this is going to focus on is stretching your low back across your hip and down into your IT band. Okay, so IT band runs along the outside of your thigh, typically a tight, not necessarily muscle, but area. It's a soft tissue that runs along the side of your thigh. So what we're going to do here is you're going to release and stretch the low back and hip. A lot of tension there. It's the weight of your leg and gravity is going to help stretch it. So these you want to hold for 30 seconds. Just bring this down a bit. You want to hold them for 30 seconds. So making sure you're breathing, you're relaxed as you come across. Just like the other videos, I also want to mention you do want to warm up before you do this. This is exercise, so you can't just jump into it cold. So your warm would be like 5 minutes of light movement. Once you get a light sweat, then your body's ready to get into this. So again, the first one, the hip oblique, is going to be stretching the short muscles. The short muscles, again, are going to be things that are locked up in your hips and low back, and releasing it across, just using the weight of gravity to pull your leg down. Make sure that that leg that's crossed doesn't touch the ground. You lose some of the stretch that way because some of your weight is touching the ground. You want to keep that elevated so gravity is gradually pulling it down. Now again, making sure you're breathing, don't hold your breath, don't induce any pain. Some of the other videos I talked about stretching, if you induce pain, it actually makes your muscles contract and fight that stretch. If you're holding your breath, they're not going to relax. So making sure you're not inducing pain and you're not holding your breath on this stretch. Again, this one was done in some of the other videos we talked about with stretching. This one is more specifically geared toward those that have hip and low back issues for the corrective stretching for your lower body. Now again, the corrective component of this is that you're stretching and then you're activating. So if this is your muscle and it's real tight and you stretch it, it typically goes back to that tight position. That tight position is because the opposing muscles are very weak. So you're kind of focusing on that balance and coordination between the muscles, and that's what this is going to focus on. So again, you would start off with the hip oblique, you'd hold it 30 seconds one side, keep the leg off the ground, then you switch 30 seconds the other side, keeping it off the ground. Once you've completed that, you shift over to the lying hip twist. Now there's two versions of this. This version here, you have straight legs, you're going all the way over back and forth, kind of like a windshield wiper. That is an advanced version, which says here, advanced, keeping the legs straight. That's only if you're very advanced. Those are very tough to do effectively or with correct form. The way I want everyone to focus on is 90-degree bend at your hips and your knees. So your knees are bent, you're going to rotate them left to right. You're going to keep your head and shoulders on the ground, so you're rotating all the way across, left to right. Then you want to exhale as you go to the floor, inhale to center, exhale to floor. Inhale to center, exhale to floor. So it's just a slow rotation left to right. Now as you come down, you should just touch the outside of that thigh to the floor. Don't just let it slam down, don't lie it down. It touches and then you go back. So there's really no stopping in between left to right. So what this is going to focus on is strengthening the muscles that rotate and stabilize your hips and low back. Very, very effective exercise. Sometimes you get some pops and clicks as you go across the first couple times, and that's just mainly helping align things. All right? So if you have any real significant low back issues or seeing a chiropractor or physical therapist, show them this stuff. This software is from a physical therapy company, so there's nothing in this that's going to be harmful. Always talk to your physician, obviously, before this stuff. But show this to your chiropractor, show it to your physical therapist and or general practitioner. So once you complete these two, now this one you're going to do 20 reps on each side. So it's 1, 1, 2, 2. So you have to count each one from each side as you go through it. Okay, and then after you do these two, you can do up to 3 sets. So you might want to come back and do it again, and then back and do it again. If you're just starting off, maybe 1 set of these should be enough, and as you advance, increase the number. You could do this 2 to 3 times a week. You don't need to do it every day. It does give you a lot of, it does actually help to strengthen the low back and hips quite a bit, pretty quickly. So it's actually using those muscles to help to try to stabilize the joints in the low back. Now we go down to the next two. So we have hip oblique, which is going to be here, which is going to mostly stretch your piriformis muscle. So there's a couple different ways to do this first stretch. Again, each of these stretches is going to be for 30 seconds on each side. This one here, pulling your leg in like that can be somewhat difficult. One thing you can do is actually use a towel, wrap it around the leg that's up, and then you can kind of pull with that towel so you don't have to pick your head up and stretch and strain your arms. Or what you can also do with this one is you can bend this leg instead of keeping it straight and then put the ankle across that knee. So you'd have a bent knee like this on the foot on the floor and kind of cross that across there. You're going to feel a lot of tension and burning maybe in the outside of your glute on that side. So this one, if you're doing it to the right leg, you're going to feel that inside your right hip. You can adjust the amount of pressure based on how hard you pull or how hard you push, but try to, again, it's 30 seconds, try and relax. Over time, that muscle will start to relax a bit more. You can push it a bit more, but don't induce pain, and make sure you're breathing in and out nice and deep. All right, so after you do that, one on the right, one on the left, then you're going to shift here. Now this is a hip bridge. We've done this in some of the other exercises. The main thing on this one I like to focus on is your positioning of your feet. So you can see here with her arms, she's actually just touching her heels. Your feet should be in line with your hips, and if you reach down with your arms, you should just about be able to touch your heels. If you can't get them in that far, that's fine as well. This here is showing a little bit more advanced one. We're actually doing a shoulder stretch at the same time. This is, again, more advanced. This one here, you just have your arms out to the side. They don't have to touch your heels. Two different ways you can do this. You can either hold it up for 30 seconds, and again, just count in your head. It doesn't have to be specifically 30, but about 30 seconds. Or you can do a hip bridge where you raise and lower. Okay, and you do that 15 to 20 times. So down and up. Now, one thing on this exercise you want to focus on is you want to exhale on the way down, inhale on the way up. And that breathing goes right along with your movements, okay? So, to focus on this one is going to strengthen your low back, glutes, and hamstrings. Typically the muscles that are going to be weak. And that helps to activate those muscles. Again, stretching the short muscles, working the weak. Stretch the short, work the weak. Back and forth. You could do one set of these, you could do 2 sets, again back and forth, or 3 sets. 3 sets is going to be the most optimal, but you might want to start with 1. So again, stretch one side, stretch the other, do this. Hip bridge, either hold it up or go up and down. Or another version as well, which works well with this, is you do your repetitions up and down, and then hold it for 30 seconds. So then you have much longer amount of time that those muscles are really firing. A lot of hip problems arise from very weak glutes. We sit a lot or sit too much, which typically weakens our glutes, and this is one exercise that specifically helps to target them. Now if we shift down to the next 2 or final 2, I've talked about this one, a hip flexor stretch, because hip flexors are notoriously very short because we sit too much. So when your knees are bent at 90, your hips are bent at 90, it tends to tighten up and shorten your hip flexor. When your hip flexors are shortened, it pulls your pelvis down and forward, which overstretches your hamstrings. So a lot of people think that their hamstrings are tight, but really they're overstretched because the front is shortened. Okay? So if we look at this one, what we're doing here is your hip flexor is going basically from the front of your hip down towards your knee. So what we're doing is we're stretching that position. We're trying to get it back behind us. If you want a deeper stretch, you can take your upper body and go vertical with it. When you go vertical with it, it's actually almost bringing your hip flexor behind your body. So the main thing on this one, again, you're going to be very tight, especially if you sit quite a bit. Don't induce pain. Okay, go to a certain point, you feel it stretch. As it stretches a little bit more, you feel it release, go a little bit more. Make sure you're breathing, don't hold your breath. So again, 30 seconds on each side of that one. It's going to release your hip flexors. Once you release them, that they're typically short, then you want to activate the weak muscles. So your weak muscles are going to be your glutes and hamstrings and low back. So it's going to be low back, glutes, and hamstrings all together. Now this one shows it with a bar. You don't need to use a bar at all. You can basically, I usually tell people just touch their ears, knees slightly bent, fold at your waist, exhale down, inhale up. You want to squeeze your glutes and hamstrings as you come up. So on the way down, they're stretching, and as you fire them and tighten them up, they're pulling you up. So keep your back nice and straight. So you're basically going in a bending position. You're folding forward and then contracting on the way up. So exhale down, inhale up. Exhale down, inhale up. So again, do 15 repetitions of these. You don't need to use any bars or any weights. If you have them, you can use light weights. Just make sure if you use a bar that it's not on this bone right here. That's your 7th cervical vertebrae. Should be below that. So more on the meat of your traps, which is where you want to put the weight. You kind of fold forward as you come up. Your knees should be slightly bent. Don't let your knees go straight or buckle backwards. That's not good for your knees. So a slight bend in the knees. And if you can only get to here, that's fine. Over time, you want to get to this parallel to the ground with your upper body. You're never going to go below that because then you're going to round your back. You also want your hips to kick back. You don't want to stay stable like this and round forward. That's not what we're looking for. We're not looking for rounding. We're looking for the hips moving back and forward. Okay, so it's more of a forward and back with your hips, and your upper body goes down and forward. So again, you can do, just reduce the size of this. So these 6, we have activations, or have stretches and activate. Stretch the short muscles, work the weak muscles, back and forth. So they're always paired up, so you can do 1 set of each, You can do 2 sets of each. You can do 3 sets of each. It's basically a very effective program to help activate the muscles that get very weak from sitting, or if you have, chronic back pain. These are typically exercises you're going to see that physical therapists and chiropractors are going to use to help you stabilize and strengthen your low back area. If you have any questions, feel free to message me. Again, you can obviously print this out. You're going to get a PDF with this. You can bring this to your physical therapist or chiropractor. They might make some modifications for you, but it's just a nice, simple program to use. And again, this is physical therapy software that I use. So it shouldn't be anything they have not seen. They might even have some other things they may add to it, but it's a very effective way to help strengthen your low back, hips, and really your core exercises. Thank you very much. Hope you learned some things. See you next time.